Hello, and welcome back to another episode for EnVue Health. I am Dr. Lucretia Sewell, CEO and co-founder.
I'm Shermaya Holland, the CTO and co-founder.
And today we have a guest with us, Dr. Smith, who is very much so excited to be with us and share some of her knowledge regarding mental health. So, as far as our updates, please be sure to follow us on Instagram, on Facebook, on Blue Sky, on LinkedIn and YouTube for the updates. But what we have been working on right now, continuous rebranding. As you know, we are EnVue Health now, no longer Melanated Healthcare, but that is our origin story. But sticking with EnVue Health for now. Hopefully, no more changes, y'all. But anyways, excited for our progress in regards to more providers on our platform, getting all the providers credentialed with EnVue Health so that you all will be able to schedule your telehealth visits with our credentialed providers, and also getting more providers on the directory and some of our collaborations. Shermaya, do you want to talk about some of the tech developments that we have in place?
Yeah, so we are really working hard on the website and getting that fully functional and ready for you all. Expanding our website. So we do have a website and a landing page in which you can access now, but we are expanding that experience. And so we're working towards getting that finalized and available to you all. And we're also working through our product roadmap. Dr. Sewell, you know how that goes. Just enhancing that provider experience and ensuring that we are providing the services that you all need. That is our update from a tech perspective.
Absolutely. So we have some exciting news. Someone was lucky enough. Shermaya, go ahead with that.
Yes. So our giveaway. So thanks everyone that liked and shared and commented and participated in our giveaway this month. And Ollie, congratulations to you and in winning that gift card for some lovely desserts. I actually spoke with her and she was a delight. She had been there several times, and so I know that was a great giveaway for her. So just excited about that. So definitely sign up for our newsletter. As you see those things come, we'll be promoting things, and hopefully you can be a person that wins one of our giveaways.
Most definitely. So for the month of May, there are a lot of happenings, like a lot of things that we need to be aware of. Women's Health, International Day of the Midwives. Thank you to all the midwives for your hard work and all that you do from a women's health nurse practitioner. And National Nurses Day. Happy Nurses Week. Happy
Yes.
Nurses Day. I love you guys. Thank you. Employee health and fitness awareness, lupus awareness, melanoma, skin cancer detection and prevention. Please wear y'all sunscreen, even if you're brown. Thank you. And
Yes.
mental health awareness. So that is where we have the great Dr. Smith. Also, she's not only a therapist, but she's also a certified personal trainer. So speaking of fitness, the girl, she's got it. So Dr. Smith, if you could take it away and just kind of give us your insight when it comes to fitness, when it comes to mental health, how that came together for you, and just talk about what the people need to know. Let them know what's up, girl.
Thank you for having me this evening. So, when it comes to mental health, I feel that everybody is struggling a little bit right now. So, we just got over the winter break, a little bit of that winter blues, and we're coming into the spring. It's nice and sunny outside. So, we're getting back into the groove of things. So, as far as mental health and wellness, um, I believe the importance of integrating both. Oh, all right. I believe in integrating both mental health and wellness because you can't have one without the other. They go hand in hand and correlate together. So a lot of people are suffering from trauma right now, seeking providers, especially in the African American community. And as a mental health provider, it's important for me to be available in the community. Um, and just promote overall well-being, wellness. So yeah.
Absolutely. And all the things that you said, I mean, just seeing it from a provider standpoint in clinic and just in general is it's there. So one of the things I wanted to ask you were like, what are some tips that you've been giving your patients that you see in office, like on a daily basis, as they come out of these winter blues and all the things that you described, like some of the things that you would recommend when it comes to mental health and wellness going together?
So the main tip I give all of my clients is just getting your daily dose. Um, your dopamine, your oxytocin, your serotonin, and your endorphins. And those are the happy chemicals that are released when you're moving your body and you're getting sunlight and just you're just overall happy. And it helps with anxiety and depression. So I encourage my clients not only to address their mental health, but also to move their bodies. Even if they can't get in the gym, take a walk. It can be something simple. It doesn't have to be, inside a facility. You could do a 10, 15-minute walk around the block, going to the park, spending more time with family, and just getting those chemicals on a daily basis. Sunlight. So another thing would be is to lean on your support systems. I know just in personally, I have a lot of friends and family that feel like that they have to be strong all the time, and they don't want to be a burden for other people, so they don't ask one of them people to. So I feel that people just need to lean more into their support systems and ask for help if needed. And there's nothing wrong with that. That doesn't make you weak. You're still a strong person, even if you need help. So we all should have a good support system. So those are my two things.
I'm glad you mentioned that because I think well, I know in our culture it can feel that way. It can be, oh, I don't want to lean on my support system, or if I do seek therapy for my mental health, then I'm not considered strong, especially being an African American female. And so I'm glad that you touched on that it's okay, and mental health is not. It's not something to be afraid of, nor to be ashamed of, and it's something you have to manage on a day-to-day basis. I think everyone has to. So I'm glad that you touched on that, Dr. Smith.
I wanted to also touch on just the stigma in the Black community with seeing a therapist. A lot of times, with history, we were told to keep things in the household. Don't disclose information. Everything's secretive. And it's shameful to go see a therapist. So I feel that it's becoming less of a stigma in the community. Even therapists have therapists. I've had a therapist in the past. So we are making a headway when it comes to the increase of people seeking mental health services. I believe so. What do you all think?
I was just going to say, I mean, I personally refer out for mental health, but I do notice that there have been more people requesting behavioral health referrals and really just accepting that they need to be able to speak to a professional. So I totally agree with you from a clinical standpoint that I see more people just more willing to get the help that they deserve and need. So I'm there with you.
And I always explain to people, if you have issues going on with your physical health symptoms, you go see a medical doctor. So the same thing with mental health. A lot of times people, again, are shameful and they feel like they can fix their own problems when it comes to mental health, but you don't do that for physical symptoms. So you shouldn't do that for mental health as well. So
I agree.
Yeah. So what are the best I guess the best ways to reach out to a therapist for someone who doesn't know how to navigate, besides accessing our platform for the providers that are already in our directory. But besides that point, how else would you suggest if someone wanted to reach out, and as far as how to navigate just getting therapy? Like, how do your
That's a
clients?
great question.
Mm-hmm.
The internet has all the answers. So, but a great database that has, and you can look for um, therapists that suit your own needs, African American therapists, you know, Latino therapy, whatever it may be, you can specify that. But it's Psychology Today. If you go on Psychology Today, you can type in different things and find a therapist that suits your needs. And every therapist specializes in different things. It could be trauma, medical, um, children, adults, a whole array of different issues. So Psychology Today would be the number one. And of course, your PCP providers too. They have a list of therapists.
Thank you for that. Is there anything else that you want to add? Maybe a fitness tip that you have for the people, Miss Trainer, or anything else?
Fitness tips. I would say start off doing something that's feasible for you. It doesn't have to be in a gym. Little 10 to 20-minute exercises you can do at home, something simple. Keep it simple, keep it fun. Um, and nutrition is important, especially in the Black community. I feel like nutrition isn't talked about as much as it should be. So making sure you just I believe in the 80-20 rule. 80% clean, 20% you eat the things you enjoy. So keep it fun, keep it simple, and don't stress out about it. That's a tip I have.
I love that you said don't stress out about it. 'Cause
Mm-mm.
people make it a big job, and like you said, have fun with it. I mean, it's your journey at the end of the day. So
Yes.
yeah. Shemaya, is there anything else that you had for Dr. Smith, or?
Well, yeah, I just wanted to go back to just the mental health piece and women's health as well. And I think what I've noticed, at least in my circle, and not that I'm going through this myself because I'm not there yet, but in my circle, I am noticing in women that are going through menopause and understanding the brain fog that comes along with it. And recently
Mm-hmm.
being a mother and thinking about these different phases that women go through in life, I just really want to encourage our women to seek the mental health services that they need, and to be comfortable in doing so. So just want to get your outlook on what you're seeing as it relates to like women's health and mental health.
I'm seeing a few different things. Hormonal changes, of course, especially after 40, after you turn 40. Different things going on with your body, changes in career, shifts in family. Um, I'm seeing a lot of people my age, 40 and above, becoming caretakers
Oh,
for their own parents, and that's stressful in itself. So just trying to find that balance of taking care of your kids if you still have kids in the household, and along with taking care of your parents becoming your kids. So
yes.
um taking care of your body at that age is important. And I feel with women especially, going through hormonal changes and focusing on their health more, exercise is very important. Weight training when it comes to exercise, especially weight training, your bones and your muscles and your joints are still, so that helps with that a lot. Flexibility, just being able to move your body more. Because at this point, we're doing we have multiple things going on, our careers, family, and then we start to see a decline in our health. So if we don't take care of it now, it gets worse. So starting to focus and tune in on your health now will save a lot of issues later between the ages of 40 and 60. So that's what I'm seeing. So I encourage women over the age of 35 to get in the gym now. Don't wait until you have health issues to come and, now I have high blood pressure or something's wrong to, start taking care of your health. Yeah.
I love that you brought that up because as a women's health nurse practitioner, I put that in there. Oftentimes, I thank my patients for coming in because they're prioritizing their health. They're taking the time to take care of themselves. So, as women, oftentimes we don't prioritize our health. So, I love that you said prioritize it now. Don't wait until something's wrong. Don't wait to come see us. Don't wait to get in the gym. Just don't wait. Prioritize it now. You don't want to be reactive. You want to be proactive in this work that you have ahead of you. So
Yeah. And it's not selfish to do that. We feel that we're being selfish if we prioritize our own self-care, but it's really not. If you don't prioritize your own self-care, you can't take care of anybody. So you have to do that first.
big facts. Okay.
Yeah.
Yep.
Yeah. So I guess going back to the whole stigma thing, how do you think that we can continue this work in getting rid of the stigma, especially in the Black and Brown community? I know that we're seeing more patients, or I shouldn't call them patients, they're not patients, more people going forth and being more open to it. But what else do you think that we should be doing in the community as healthcare professionals to just get rid of the stigma? What are your thoughts on that?
Doing exactly what you're doing now with these platforms. You have an amazing platform where you're able to bring together a lot of providers to speak about.
Okay, unfortunately, we lost Dr. Smith due to some technical difficulties, but we truly had a very insightful conversation with her. So hopefully, you all will reach out to her and her practice at Total Life Changes. And then we'll also drop her information in the event that you are in need of mental health services. Again, do not delay. Be proactive rather than reactive in this work that you need to do for yourself, for your family, for everyone around you. Because if you aren't good to yourself, then you can't be good to anyone else. So that's my plug there.
Yes.
Okay, Dr. Smith is on her way back on. Well, I think we've recovered her.
I was saying we need to get the information out in the community more. So, and I feel like we're doing a better job with that, but we could work a little bit more with getting the information out about who provides what services as far as therapists, nurse practitioners, and just working together to collaborating with each other. That's a big piece.
Collaboration, absolutely.
Yeah.
Okay. Well, Shermaya, did you have anything else?
I'm just going to say that definitely take care of yourself, honestly. And I do agree with what you're saying, Dr. Smith, that we have to do better at ensuring that the stigma is being removed and decreased in our communities, and that does take us working together. It's ensuring that the information is there and readily available, but also just not having that judgment lens on either, and encouraging your friends and family to seek medical attention and mental health services when we see those indicators. And I think most of us probably have seen those with family or friends, but being open and vulnerable enough to say, hey, I know a therapist that can help you here, and maybe leading them to that therapist. So I'm glad that you're doing this work, Dr. Smith. I know it's not easy. But we greatly appreciate people like you that are out on the front line.
Thank you. Appreciate you guys as well. Appreciate that.
Thank you so much, Dr. Smith. Do you want to share your contact information so the people can find you and all the providers that you have all therapist providers that you have within your practice?
Yeah, so my practice is Total Life Counseling and Wellness. Our website is www.tlccoflouisville.com. And we are also on Instagram and Facebook. My personal Instagram is the Fit Doc. That's on IG. Yeah, so we see clients from as young as 5, all the way up to seniors. So we do community-based work, school-based, in office, and online.
Do you
We
accept?
accept all insurances.
Awesome.
So we try to make it accessible to everyone.
That's awesome.
So thank you.
Thank you, Dr. Smith. Any closing remarks on your behalf before we wrap up this talk today?
My closing remark would be to take care of yourself. Don't pour from an empty cup. It's impossible. So start with taking care of yourself so you can take care of the ones you love.
Thank you.
So,
Well, thank you all for tuning in to today's talk. We sincerely appreciate you coming on, Dr. Smith, and having this talk with us. This conversation so needed, time and time again, not just for the month of May, but
Yes.
on the regular. as adults and adulting and all the things that we have to endure in this life, we all need a therapist. So please reach out to Dr. Smith and her team. They are readily available to take care of you and your needs. And like she said, as young as 5. So no excuses. If you see those indicators, as Miss Holland stated, like get to a therapist. There is no shame.
Yeah.
No shame.
None at all.
Yeah. So in closing, don't forget to follow us on YouTube, on Instagram, on Facebook, on Blue Sky, y'all, LinkedIn. Come find us. We are on all the socials.
Yes.
And would love for you all to join our newsletter to keep up with all the things as Miss Holland mentioned, Shermaya mentioned earlier. We have some giveaways that we've been doing. So you got to be signed up on the newsletter for that. So sign up, y'all. Let's get it.
Well, thank you for having me.
Oh, thank you for being here. You just don't even know. Appreciate you, Dr. Smith.
Look, my phone done died. I jumped back in.
Well, we appreciate your determination to be a part of tonight or today's show or whatever time of day. Today's show. I forgot what time of day that we were streaming, but yeah, thank you so much, Dr. Smith.
No problem at all.
All right. Well, I will wrap this up as I mentioned before. Thank you guys for tuning in. Tune in next time. Thank you so much. Bye.
Thank you. Have a good one. Bye.
You too. Thank you, Dr. Smith.